Look, it's been a brilliant day. It's been our first National Health Protection Conference. It's a milestone, a landmark as we've progressed through the health protection strategy. What was great was seeing so many of our talented colleagues from all over the country and internationally gathered together here in Dublin today, reflecting on the achievements of a year in delivering our health protection strategy. We have achieved a huge amount in the work that we've been seeking to do. And we've summarised it in part through the publication of our first annual report, our Year 1 progress report. And this document really doesn't do enough justice to the work that's been done, but it does demonstrate not only the amount of work that's been achieved, but the commitment behind it. So this work represents the dedication, the commitment, the professionalism of everyone who's been contributing to getting this job done.
So we have had one of the lowest excess mortality as a result of the pandemic, but also one of the lowest hospitalisations during peak surges. Also, we had one of the highest uptake rates in our vaccination programme, and these are all successes because of all of you here in the room.
You're someone who had an alternative career. The rest of them, I'm not sure what they would have ended up doing. So I kind of have to ask, you chose to do this over going tour with Michael Flatley, ultimately.
And isn't it worth it?
That's what I was going to ask you. So why do you do what you do?
One of the key essentials of a health professional is curiosity. And I think that curiosity is a trademark of public health, because it is about that, the unanswered question: why is this happening? Who's it happening to? What is it we need to do differently? And is there something we can actually develop? And that often then becomes a career.
It is people working for people, and I think it's a huge privilege, certainly for me, to be part of that, to be working on behalf of our population. I think very few people across society in their various different occupations get the opportunity to do that.
Investments come when politicians are convinced that they save something by prevention or by investing in measures. So our health economic capacity has to be bolstered so that we can present data that they can feel confident: if I invest now, I save later.
By getting the evidence to deal with policy, to working with that to get government to provide the financing and the policy changes and the legislation, and then ensuring that we have the right data to make sure it's right and update and change it is life-changing for the population, not just for the single individual in front of you. And so that's why I am here, for that sort of population level approach.
For us, for this job, for this time, it has never been more important for us to work collaboratively, and the internationalist agenda is even more important now that so many parts of the world are even more polarized, as Greg said in his presentation, than they had been previously.
Because like the theme goes, nobody's safe until everybody's safe. So even if Ireland is safe, if other countries are not safe, disease can cross the border very easily. So it was very good.
I think it's really important that we understand the threats across the world, so we need to collaborate to do that. It's really important that we understand the threats in our borders. We need to collaborate to do that. We learn so much from each other and how we respond, and using all of that makes us better in protecting the health of the public.
I enjoyed many things, but one of the things I liked was Dr Andrea Ammon talking about health economics. I think that's a really important part of the work we do, to show the benefit of the work we do.
It's been absolutely lovely listening to my colleagues talk about what we've done with respect to the strategy so far. I've really enjoyed learning about the stuff in the immunisation and vaccine space. The health preparedness and the threats preparedness has been amazing to listen to. So overall, a fantastic morning so far.
And I think that for me, the key messages are that as we move in health protection towards an all hazards, one health-based approach, that really the key things are collaboration, both regionally, nationally, internationally, multidisciplinary working, and also community engagement. And I think really underpinning that is strong public health leadership and advocacy, working to reduce health inequalities and really advocating for those marginalised populations that we serve.
So just thinking about the focus of nobody's safe until everybody's safe, I think vaccines is a really good example of that. And you can see here some work that was done for European Immunisation Week a few years ago, showing in terms of our cases of some of our vaccine preventable diseases in Ireland in 1950, and then now that was in 2017, and those circles would be even smaller now, showing how much effect we have had in the vaccine programs in terms of reducing the morbidity and mortality of infectious diseases. And in terms of the work that we do, we don't know that we protected you against getting an infectious disease, but we do know there are more people alive and more people who haven't been affected by infectious diseases because of our high quality programs.
Running through the health security framework here that we're dealing with, we have all hazards approach, interoperability, intersectoral networks are key, and we've mentioned the avian influenza work with our colleagues in the animal health side. We also have to monitor and evaluate everything we do. I mean, preparedness is not an intangible. We have to be able to touch it and to measure it and to monitor it so that we can improve it. What you measure, you value. And finally, we have a continuous quality improvement approach.
So it prompted a clinical review of paediatric cases. What differentiates more severely ill IGAS cases from less severely ill IGAS pediatric cases? Ireland has undertaken a study, and ECDC were extremely grateful to the European EU Health Task Force, have also assisted us and expanded it to Europe. An IMT was formed in December, which undertook the investigation of this. IMT chaired by Dr. Una Fallon, and this multidisciplinary IMT monitored and provided support for the investigation and management of this outbreak.
All the presentations gave a good overview of what Ireland is doing, and I am very grateful for the good partnership with Ireland.
The ambition for our programme is nothing but upwards. We have an ambition to make Ireland an international centre of excellence in health protection and public health. Our ambition is not unrealistic. It is grounded in our own confidence in our ability to do this and the strength of the partnerships that we have and the ones that we're going to build.